right. Good morning. My name is Maria Lorente Foresti, and I'm the director of the San Mateo County Behavioral Health and Recovery Services Office of Diversity and Equity. Today's meeting has been coordinated by San Mateo County Health, the Spirituality Initiative, the Office of Diversity and Equity, Peninsula Solidarity Cohort, and the Office of Community Affairs. We are honored to be here with you today to thank you for your work and support all of our faith leaders in caring for our communities. Next slide. Please be informed that this meeting is being recorded, and by being with us today, you are giving consent to our photo and video notice. Next slide. I'd also like to review our Zoom housekeeping recommendations to raise your hand, and if you would like to share. Keep yourself muted unless you are speaking. Please select speaker view. It's on the top right corner of your screen to help with viewing the slides. Use the chat box for any questions, and know that we will be sending this PowerPoint, the meeting recording, and other related materials to you after the meeting. We'd also kindly ask that you turn off your video unless you are speaking. Next slide. And I am happy to now introduce our moderator, pastor, and BHRS Spirituality Initiative co-chair, Isaac Frederick.
Good morning, everyone. I'm happy to be here with you today, and we're going to have a good discussion. This reminds me of how the Bible talks about how we're overcome by the words of our testimony. So we hope that we're able to have a good time with each other today, with you all. So I just want to go over our agenda real quickly. You see we are going to have a dialogue and discussion with some of our BHRS staff. We have Megan with us today from the Office of Office of Community Affairs. And then we're also have the pleasure of having our health chief here, Louise Rogers, who's going to talk to us about the COVID-19 vaccination. That's what our discussion is about. And then another key and critical point is we want to get feedback from you all. We all learn from each other, and we want to continue to build this bridge of participation and collaboration. So we'll get you guys' feedback. I'm just giving you all feedback. And then also, then we're going to close. Spiritual Initiative has a closing for you all, and then we'll wrap it all up. So at this point, now I would like to have the pleasure of introducing Megan from the Office of Community Affairs, who's going to go over some of the updates and the key things that we're doing, that they're doing also collectively in the county. Megan?
Thank you so much, Isaac. Good morning. Next slide, please. I'm going to spend just a few minutes presenting some new campaigns our office is coordinating regarding the COVID-19 vaccine outreach. So the Office of Community Affairs is creating messaging that's culturally and linguistically appropriate. We're using trusted messengers and other strategies to reach our targeted communities, and we're aligning all of our communication efforts with federal, state, and local levels to ensure that messaging is consistent, accurate, and timely. Next slide, please. So this is one of our new campaigns. These are images that we're creating to reach really specific targeted communities within the county. For example, the images on the left are targeted towards our farm workers that are living on the coast, and they'll be generated or created in Spanish and English. We're also creating a series of images targeting our older adults in the county in multiple languages. And of course, we also want to try to promote positive feelings with messages of hope. Next slide, please. The campaign you see here is based on well-known trusted messengers in our county, and they're answering the question of why they are getting the vaccine. For example, Lisa Teeler, she's the executive director of the Bay Area Community Health Advisory Clinic, and she said that she's getting the vaccine because she wants to volunteer again at her church. We're creating these messages in multiple languages, such as Dr. Vinny's, which is in Tagalog, and his community is in Daly City. And these are really powerful ways to reach our communities. Next slide, please. We're also coordinating with trusted messengers to create simple videos. So just using your own phone and talking about the importance of following guidelines to stay safe or to get the vaccine when it's your turn. Next slide, please. Yesterday, as part of the vaccine communication workshop, we met and we discussed reaching out to the older adults in our county. So when we were identifying trusted messengers in our breakout groups, I heard again and again that the faith leaders are their trusted messengers. And so therefore that's the group that's here today. Having you create and share this information is hugely impactful. And there's lots of ways you can do this. You can create videos on your phone. You can bring up the vaccine if you have a phone tree with your congregation, so you can speak to people about the vaccine, or you can include graphic and messages in your weekly bulletins. I believe many of you receive our weekly communication calendar, and it's a great way to just pull graphics and pull simple messaging and include it on those bulletins. Next slide, please. And our ask to you is to please join this new campaign. All we need is a picture of you in a mask, or when it's your turn to get the vaccine, take a picture of that as well if possible. And then to complete the statement, I'm getting the vaccine because. This can be in English and if possible, the language that's spoken in your community. So it really resonates with the folks that you are working with. On the bottom of this slide, you can see our email. If you have any questions or if you need any information or you need any more messaging or flyers or collaterals, please reach out to us. We'd be happy to share this information with you and work together to come up with ways to reach all of our residents. Thank you so much, and I'll turn it back over to you, Isaac.
All right, well, thank you, Megan. There was a question, but that was answered in the chat. So I want to just give everybody another quick reminder. Just go ahead and use the chat if you have any questions, and we'll do our best to get those responded to appropriately. So now I have the awesome pleasure of introducing our Chief of the Health System for San Mateo County, Louise Rogers.
Good morning, everyone. It is so good to see all of your faces. I'm sorry it's virtual, but many of you I haven't seen in a while in person, and it's very nice to see your photographs and your film up there. So I really want to follow from what Megan was just saying, which is, the vaccine rollout, it's really going to rely a lot on community leaders to help get the word out, and also, to answer people's questions, to provide good information or to guide people about where to get information. And so we are expecting that you all, as leaders in your faith communities, are likely to be looked to for guidance and to get a sense of where you personally stand on the issue of the vaccine, and also for people who will be interested in knowing what your experience is. So my goal this morning is really to give you some information. I don't want to give you too much information. I want to go to wherever the questions are, the information that would be most helpful to you. And so I welcome questions as we go through this, and also in the follow-up to take the information in a different direction if it would be helpful. But for starters, I wanted to share some overview information about the vaccine rollout in our county. Before I do that, I'll just acknowledge where we are right now with respect to the pandemic. You all have heard that the governor released us from the stay-at-home order, and now our county is back in the purple tier of restrictions. And there's still a lot of restrictions. At this point, the only real change was restaurants can open outside and hair salons and personal care services can open. But we're still really struggling with the pandemic, with the rates of the spread in our community, which are still quite high. And we have about 35,000 cases in the county since the beginning of the pandemic. And I should point out that the last month was actually about a third of those cases. So the volume of cases just in the last month was enormous. And our Latinx community has been the most impacted. And our deaths now are well over 300, 356 deaths. And the vast majority of those deaths have been in our older adult community. We are seeing a slight downturn, but as I said, the virus is present. We're concerned about the new variants, and it's really critically important that everyone continue to avoid gatherings, to social distance, and to wear face coverings. Next slide. So we're really encouraged by the arrival of the vaccines because the vaccines are really the most important intervention that we have in this nation for ending the pandemic. And the Pfizer and Moderna vaccines, which are the two that are now being distributed, are safe and effective. They're going to be provided to everyone at no cost. The rollout of the vaccines is expected to be phased to groups based on their risk level, and they will be widely available to the public later in 2021. Right now, the supply of vaccines just isn't sufficient to be able to make it available to everyone all at once. Next slide. And so there are three principles that have been most elevated, actually at every level in the distribution, starting with the federal government and then the state and then locally here in the county. Three principles that we believe really have to be shared and emphasized in order for this vaccine rollout to be successful and in order for the vaccine to be accepted by our community members. And those are safety, the safety of the vaccines themselves and the process for getting them out, transparency of information about the vaccines and all of the processes around distribution, and also equity, that the results of the whole process lead to our communities who have been most impacted by the pandemic, which is our communities of color, our essential workers, our older adults, having access to the vaccine. Next slide. And there are different roles and responsibilities. This is kind of a complicated slide, but just to say very simply that the federal government is who approves the vaccines and evaluates their safety and confirms it, and then recommends which populations should have first access. And then the state of California manages it for California and takes all of that guidance and translates it into the rules that we have to follow locally, and also receives an allocation of vaccine supplies from the federal government that they then allocate locally. And they do that by allocating supplies directly to the really large health systems like Kaiser and Sutter, and then also allocating to the county. And our role is really to make sure that the smaller providers receive a supply of vaccine and that the communities that are least likely to get access are getting access to the vaccine. Next slide. So locally, we're really focused on coordination, communication, which Megan just talked to you a little bit about, the focus of that work. We're focused locally on vulnerable communities and making sure that some of the barriers to access are addressed in our communities, and also providing data. Next slide. And so building from those three principles that I mentioned earlier, we have built those out to emphasize really seven different aspects of the local approach, providing transparency, prioritizing those that shoulder the most risk. Really important that we acknowledge explicitly the negative and painful history of healthcare in the United States, particularly in communities of color, and the health inequities that have led to a distrust, not only in healthcare, but in research, the kind of research that led to the development of the vaccines, and distrust in the government. We feel that acknowledging this is a very important part of the messaging for our communities to trust and accept the vaccine. There is a community stakeholder process so that we can learn from the concerns that our community members have, including you as leaders of the faith community, so that we can get better and so that we can communicate effectively and overcome the different barriers that will be faced in order to provide broad access to the vaccine. Next slide. So really simply, most people in the county are going to get their vaccines either directly from their existing providers, and that could be Kaiser, it could be Dignity, Sequoia locally, it could be Sutter or Palo Alto Medical Foundation, it could be Seton, it could be Northeast Medical Services, Ravenswood, or other local clinics. It could be Stanford, which is a major provider. And then we're also actively trying to enlist more providers in participating in the whole effort. And then if you're a resident of a long-term care facility of any sort, including the assisted livings and the big senior serving communities, you're likely to get it from Walgreens, CVS, or Safeway. The vets are already accessing it via the VA, and they're doing a great job. And then clients of the county, and we intersect with about 100,000 residents a year, will likely be getting it through our efforts, not only our clinics, but the special vaccination clinics that we mobilize in order to create access in the different regions of the county. And then providers who are learning more about their access to the vaccine are trying to reach out to their patients as they become eligible for the vaccine. Next slide. So this is the state guidance right now about who will get the vaccine, and in phases. Frankly, it's kind of changing every day. But what we can say with certainty is that phase 1A, which is already well underway, includes about 50,000 people in this county who are healthcare workers or medical first responders or residents or staff of long-term care facilities. And then the next phase, and we've already started this, although supplies have limited getting it out fully, but the next phase is older adults, people over the age of 65, and also essential workers, teachers, childcare workers, emergency services who are not medical but police, and then food and agriculture. And this is an enormous group in our county. It's 167,000 people. So phase 1A, and then this next group of older adults is where we are now, right now in the rollout, limited by supplies. Then the future phases are listed here, but the state has said that they're thinking of shifting to a purely age-based approach. We're waiting to hear that, but it sounds like they're thinking that this is just way too complicated and it may work better to just shift to an age-based approach. Next slide. And the timing of these phases has been now through February for the first phase. And then the next phase is expected to happen late February through April. And then April through June is when the general public is expected to be able to access the vaccine. And if there were enough vaccine flowing, these phases could change and could be sped up. And we know the federal government is really focused on how to increase supply of the vaccine so that rationing isn't necessary. Next slide. We know that there are a lot of concerns about people who are rich and well-connected being able to get access to the vaccine ahead of everyone else. And that's why the state and federal government are so focused on, you know, the question of the populations and the phases. And they also have issued very strict requirements for everyone participating as a vaccinator in the program. We really have to follow these rules, or essentially we will be excluded from the vaccination rollout if we don't stick to the state guidance. Next slide. So the scale of this whole rollout in our county is really enormous. I don't think there's anything in the recent past that compares to it. Some folks may remember, you know, decades ago, the rollout around polio, but really there's nothing else that compares. And so we have about 619,000 adults in the county. We're targeting to reach 90% of those, almost 600,000 people to reach sufficient population immunity to be able to prevent the spread. That would be about 6,200 vaccinations per day. We think the county will likely be performing about 1,200 of those vaccinations per day, but most of the vaccinations will be done by our large healthcare partners. And I'm glad to say that we've already exceeded 50,000 residents that have been vaccinated, and a number of those have also received second doses. So at this point, we've reached just under 10% of the adult population that we're hoping to reach. And this is about 7% of the total county population. And we're not vaccinating kids at this point, but the new vaccines that roll out eventually will be tested on children and youth, and eventually children and youth will be vaccinated, but they're not going to be vaccinated in these initial waves that we're rolling out now. And we have published data on our public dashboard now about the vaccine rollout, including the demographics. And you will be able to find that information at the link here on this slide. And we'll be sharing the slides. Next slide. So we've had a lot of great success in some early experiments. We know that at the event center, we can reach many people. We reached 9,500 people in a week. It was very impressive. That was an effort targeted at healthcare workers. We were rolling people through in 5-minute increments. Of course, they have to have observation after they've received the vaccine, and they waited in the parking lot during that time. And we checked on them, and it went really well. And so we do know that large-scale vaccination events are a critical part of the rollout. And the next ones that we have planned are targeted at older adults in addition to healthcare workers. We know that the rollout in long-term care facilities has been well underway. CVS and Walgreens and Safeway doing a great job scheduling now more than 90% of these facilities in the county. We've had pilots to reach older adults that are not likely to go to big mass events, and those have gone well, although we've learned from those experiments how hard it is to reach older adults, especially over the age of 75. And you know that there are special strategies that are needed. We're learning from these pilots, and we're also really looking at other options. So pharmacies, mobile options that it can be more accessible in the community, pop-ups that are done in trusted local community locations, which is sort of how we made testing work in this county. Next slide. So I'm interested to hear more from you all about your ideas, but wanted to acknowledge that we are aware there are a number of barriers to the vaccine being accepted by our community members. We have the challenge of just the operations of rolling this thing out and obtaining the vaccine. We don't have enough, the logistics. There's a lot of special requirements around these first two vaccines, the Pfizer and the Moderna. They have to have these crazy freezers. They have to be maintained at this very cold temperature so that they're not ruined. But in addition, as I mentioned earlier, we know that distrust is a major barrier, and the history of experimentation on people of color in particular that has led to that distrust. We also know that misinformation is actively flying around the community. There is a concern, some members of our community, that the Moderna vaccine that it's less effective, and that that people of color are receiving that vaccine because it's a lesser vaccine. People don't know that the freezer capacity and actually the physical requirements of these vaccines is actually more what influences where the vaccines are going. There's safety concerns about the vaccine because the vaccines were developed so quickly, and that's understandable. There's concerns about the data and how the data is shared and whether there will be privacy. The accessibility of getting the vaccine in communities with people who may not be likely to reach a mass vac site. And then we know that there's some people who may have Medicare, but they don't really have a healthcare provider. They're not connected to one of these big systems. And then we know the importance of messaging and outreach to our hardest to reach populations. Next slide. So a couple of things to just briefly mention that we have been doing. One is we're really leaning a lot on our website, and the link is here. The website now contains an online notification system where you can sign up and learn when you're eligible for the vaccine. And so right now, this sign up link is the way that people who are over the age of 65 will learn about the next mass vax clinic that we're mobilizing later this week. And so we want you all to know that for people you know that are over the age of 65 and may not be connected to a provider, signing up on this website is the way to learn about the opportunity to get vaccinated. So it's super important. We've been doing presentations like this one and engaging in interactive forums where we can learn and improve our approaches. We're developing partnerships with community-based organizations and clinics, similar to how we have done with the testing in order to get greater reach in our communities. And as Megan mentioned, we convened a vaccine communication equity working group to try to do a really smart job of developing the messaging. And we've had a lot of participation in that, 100 people at one meeting. And we're really hopeful that this online notification system, which is different than the state notification system. There's also a state notification system, which is important, but we're thinking that this local notification system can be the way that you get the word out to your congregations about the opportunity to be vaccinated. And then lastly, just a couple of things that you all could consider emphasizing. The vaccine is really our best chance to overcome this crisis that we're in, and for people to be able to regain some sense of normalcy in their communities, including eventually gathering, not soon, but eventually. The vaccine is safe and it's based on sound science. Your provider at this point, if you have a provider, is definitely the best path to getting vaccinated. And we've been very encouraged by the partnership we are experiencing with the large healthcare systems in the county. None of them have enough vaccine, but they all know that this is one of their most important jobs. It's the most important job at this point. It's provided at no charge. Those that are vaccinated will still have to mask and social distance, because actually people can still be carriers of the virus. The science yet has not confirmed that after you're vaccinated that you can't transmit the virus. So that's something that we're having to continue to have those, take those precautions. There will eventually be enough vaccine for everyone. The supply shortage will not last forever. And again, sign up to get notified. So that's all I wanted to present, and I'm really looking forward more to hearing from you all and answering questions. And I see there are a lot of questions in the chat, so we can take those up as well.
Yes, thank you, Louise. This actually where we're going to go to. We have, I'm looking at the time here, and we're right at the time to where we're able to have you all ask some of those questions, and they can be directed towards Louise, especially from the presentation that we just got. I know there were a couple of questions that were directed towards Megan, and they were responded to in the chat. So I appreciate you all for responding to those questions. Three things that stuck out to me was you talked about the safety, transparency, and equity. That's very important when it comes to the faith community. We have a lot of scriptures in the Bible and other spiritual books that talk about those specific things to our community, a spiritual community. So at this time, we want to go to some of the questions. And if there are any direct questions right now for Louise, before we move on, we have a little bit of time.
Excuse me, Isaac, this is
Yes.
Christina. Louise, there was a question on the chat. Is there a separate priority for faith leaders, or can they fall under teachers or a different category?
Well, the thing about, as you all know better than anyone, leaders in our faith community wear multiple hats. And so it's absolutely possible that some members of our faith community and leaders will be able to access the vaccine through another hat that they wear. The general, they end up, if they're not wearing another hat that gets them through the door, they end up in population 1C, along with a lot of other community, really community services. But you may remember that I mentioned that the state is shifting to more of an age focus. So I think that, first of all, any leaders in our faith community who are over the age of 65 should certainly be getting on our notification list and getting in the queue to get vaccinated. I'm looking at Isaac here and I'm seeing you're probably not over the age of 65.
No, not yet.
Gratitude to the younger members of our faith leader group. But there are some who are over the age of 65, and we're hoping to really get people through the door through that route. We also know that some members of our faith community are teachers, and they would fit into that bucket. But if they don't wear another hat, the chances are that they're going to get in through the age route.
May I jump in here, Louise?
Yes.
Hello, this is Reverend Mo from the Pacific Island Task Force. This is my 8th meeting that I've attended in the San Mateo County, and I've been advocating for this. True, there's a lot of ministers that wear different hats. Unfortunately, for our Pacific Island, specifically the Samoan community, ministers are not allowed to be involved in other occupation other than being the ministers. But we've been seeing a lot of deaths in the community. For example, the last 2 weeks, two, three funerals in one church. For the last 3 weeks, there's 2 or 3 funerals every 3 weeks.
Yeah.
We, the ministers, have been responding as first responders and social workers. We're the first one to respond to funerals and services and counselings. We're also involved in food distribution and everything. We are on the front line, unfortunately, and now we've been asked to lead in this vaccinations propaganda and advertising and listen. We've been preaching from the pulpit that vaccination works and asking our people. As a result, our people are ready for vaccinations. Unfortunately, when they see that the ministers are not being vaccinated, mistrust will be there. I've asked, there's another meeting that was the new administration from the Biden and Harris administration, task force person was there. They really want to change the policy. And I've been advocating to change the policy to include the ministers as essential workers. That they need, if they can be in the forefront of this campaign for the people to educate. And talking about equity, that's another thing. So I'm really pushing for, we need to change the policy, include the ministers as first responders, as essential workers for this work.
Yeah, I agree. I think this is a very important advocacy issue. It has to be addressed at the federal level, but also the state. I think that there's a great pathway to the state. The Surgeon General, Nadine Burke-Harris, and the Chief Epidemiologist, Erica Pan, are deeply personally anchored in the needs that you're describing. And so I think advocacy aimed at them will also help. But even what you just described, for example, food distribution, there's a pathway with food distribution, in the 1B group, for example. We have potentially some room here even with the existing rules. So I think the advocacy is important, and we should look at these individual circumstances and make sure that we're not missing the boat. For example, with food distribution, there may be a way to, use that angle, sooner rather than later.
So who would we go to go through that, Ben?
What's that?
So how do we go through that?
Well, if you want to email me the specific example of the person
Great.
And the role, that's one way that we can just work through these specific examples where we know, like, food distribution is a role that they're playing, and we just get very specific.
Our chairman of the Pacific Island Task Force, Ms. Tao, is also on the meeting, and so.
Yeah, I'm sorry. Yes, Louise, I just want to piggyback on what Reverend Thomas just said, which is relevant to the conversation now, because as you know, we represent the Bay Area, and Reverend Thomas is our advisory on the, on the task force. But we have been in these conversations at the Santa Clara County yesterday, the day before yesterday, and we also in the conversation with San Francisco, all in the faith community, and as well as Alameda County. What's been aligned, the same effort, what Reverend Moy is alluding to, it's happening across all the Bay Area, where faith leaders are really coming in force, from the Catholic charities to all of the different denominations, in all groups of color, are really raising their hands about, we need to do a lot more advocacy, not just on the county level, but if we approach it, Louise, you know how we do a regionally approach? The regional approach is by, you know, at least reaching out, facilitating with your counterparts, that the sentiment is really the same. And they're really desperate right now, because not only they're doing food drive, but they're doing food drive at the testing center, just like we are. And so there's traffic coming in with the food drive during the testing. And so we are right there, passing out food boxes. I mean, they're distance, they're well done, but at the same time, these are risks for the faith leaders as well. So just
I applaud your organization, and I know, Tao, from other successful efforts, that you guys can be a strong voice at the state level. And the state actually has the ability to change the rules on this. We actually don't. We've just received the nasty gram that if we change if we depart from the rules, we're going to lose our vaccinator status. But the other point to make is that right now, the older adult population is prioritized above people involved in food and education and all of these other roles. It's the older adult group. We don't have enough supply, unfortunately, right? And so that's why there's rationing. And so we do have to prioritize our efforts. And what I would suggest is a two-pronged approach. The advocacy that you describe, full court press, continuing on that. And then secondly, getting everyone to sign up on these registration systems who are over the age of 65, you know, right away. And each county, Alameda, San Francisco, San Mateo, and Santa Clara, and the others as well, all have these online sign-up systems. And the over 65, we should be getting them on that list. And that way, when we do these events, we'll just email them and let them know. And that can be another pathway that's immediately accessible. Right now, the food angle, I think, could work, but we don't have supply. And so no food people yet are getting the vaccine at all, you know, because there's just not enough supply. And then the advocacy, I think, is the way to have faith leaders called out in their own right, you know, wearing that hat, you know, as a group. And that is something that the state can do. It is not something that we can do at the local level, although we can support, you know, we can support the effort with data and all of that.
So we're right at the point to where we're actually going to go into a part to where we have some guided questions for you all, because as I indicated earlier, you know, we all learn from each other, and we want to know what some of the things that's been working, some of the, you know, some challenges, and then also just keep in mind that as faith leaders, myself being a pastor of a church in Oakland, you know, we get come to directly. Reverend Mo, you pointed out a great point. You know, often, even though I have a background in mental health and a clinical background, but we all get pointed toward directly. We're like the first people usually on the line, the front line. And Tal, you make some good points. And so we want to move forward with those questions and get some information, some good nuggets, as we would say, to kind of help each other out and also hopefully learn. And Louise, thank you for the sharing. And you brought up some good points of how we can effectively change some stuff at the state level, ultimately changing some stuff at the national level. And we can all hope and pray and good wishes and everything, that because hopefully with this new administration, there will be some effectual changes that will happen. So there are a few questions. I have some guided questions. The first question that we're going to go to, and this again is the opportunity we want to hear from you all, is how have you supported your community during this challenging times? And can you share some examples? We heard some examples regarding food distribution, but are there some other examples that you all can share of how you supported your faith communities during this pandemic? And you can go down on the slide so we can, there we go. Thank you.
Go ahead and raise your hand. If you click on participants, you can do raise hand and we'll call on you. You can unmute yourself, or you can go ahead and unmute yourself and share.
Okay, I think, let me see. Wait, yes, simply refer. Wait, I'm sorry, there's some things going on in chat. Trying to see. Okay, Bill, I think you had an example.
Sure. I'm Bill Cruzy, Reverend Bill Cruzy, I'm pastor of church, but also I'm tied in with the Spirituality Initiative and a part of Behavioral Health Services in San Mateo County. One of the questions that I see in the chat that is about Kaiser, and my congregation has, has about half of my members have Kaiser actually, and I know they're telling everyone that they just need to wait. You don't call us, we'll call you type thing, and I say don't do that. I say we must support those. What I'm saying to my congregants is start with your individual doctor. Start with your individual doctor and tell them you need to get this and see what they say. And then when they respond to you, if there's some way that I can be helpful to push this, because I think we have to become advocates for our members. Or whatever it is, but anyway, that's where we're starting. We're just getting that started. I don't have any examples of success yet, but I think that that's what has to happen, because I've learned about Kaiser over the years. I've had Kaiser for many years. You just have to advocate for yourself and for members of your congregation who need it, and they will respond. So that's the one thing that I've been doing as a pastor, and as well as just as an individual, and I'm doing it for myself actually. I'm one of those over 65. I'm almost 75. I haven't been able to get the vaccine yet, but I know that time will come.
Thank you, Bill. That was a great example, and I just want to go back to something that I heard Reverend Mo said about the food distribution. I know that's something that my church, Genesis Worship Center in Oakland, that we do, and to our best of our knowledge has tried to continue doing. It's just been a challenge doing it during the pandemic, obviously for a lot of reasons. But we have a partnership with the Alameda County Food Bank, and what I've heard a lot you all say is about 65, 70 plus, and part of the challenge is that some of our members who are that older, most of them are driving, but some of them don't, right? And it's how to distribute that in a safe manner. So what we've done was we've had several volunteers, both from Alameda County food banks, as well as our congregation, that would distribute food, not only to our members, but to other community, other people in the neighborhood. So that's something that's been very helpful. And I see Reverend Mo, I think you have a comment, a question?
Yeah, just follow up on that, Isaac. I use my personal minister as an example. Tao and the group set up the food store at one church. My pastors and our members pick up the food from that church, and he personally deliver the food to the family members and leave them outside the doors. They don't go in, they leave the food outside the doors and stuff. Another thing that my ministers is personally involved in, he makes call for behavioral to check on the mental health of the members. I just want to reemphasize that our ministers are really doing the frontline work, like Tao would say.
Thank you, Reverend Mo. Yeah, that is very critical and key, especially for our older congregants and people in our spiritual community, is reaching out to them. We know the high risk that they are, especially if they are a member of community of color.
And if I add one more, we're having a national service for our youth, and I'm in charge of that. And we're putting together a video that will show our youth ministers, our elder ministers, and our elders who are taking the vaccine, to show that the vaccine is safe as part of education. So we're doing more of that.
That is awesome. Yeah, that's awesome. And you mentioned you're putting together video. Is just a question for you. Is that going to be something that's obviously they can probably view live, but is there going to also be like a DVD or a CD that they'll get too?
The service is going to be a virtual service. It's going to be online. And we find out that the most people in our community watch it through Facebook and YouTube Live. So that's what we're doing.
Okay, awesome. Yeah, I know for my church, we've had a lot of services on Facebook Live, YouTube, Instagram, all the social medias that you could think of since we're not able to meet in person. So thank you. Are there some other questions I was giving responses to our first question? I know there's some things going on in the chat.
David Smith, go if you have.
Hi, I'm with the Church of the Highlands in San Bruno, and the first day after the lockdown, March 17th, we started a phone tree with all of our seniors. We've got about 2,000 members. So we formed a benevolence committee, and our first task was to make sure all the seniors were taken care of. And along the way, we found a lot of mental health issues and shut-in issues anyway. I mean, families who were, because of other health issues, were already feeling restrictions. So we send a team to Skyline College, and we pick up all the leftover food every Friday. And on the weekend, we make food deliveries to several families. We also, because of the mental health issues, we've developed a team of about 10 people to make sure that we can do one-on-one Zoom meetings, do personal counseling. I'm trying to expand that into taking care of the caretakers. I think they have a big burden. But I've started support groups online almost every night of the week, one on stress, one on anger, one on grief, because a lot of people are not allowed to even attend funeral services. So we've been doing a lot more focus. My focus has been more on the mental health issue. But our people have the same questions that you're asking here. There's a lot of confusion. And when they seek appointments, they just get messages saying, not yet, availability is not there. So we just all kind of have a wait and see attitude. Besides, every day on the news, there's, like Dr. Fauci this morning announced that don't expect to travel just because you've been vaccinated. That's not a ticket to go travel. And we still have to stay under the same restrictions. So a lot of my people are just saying, we'll wait. These new strains are coming out. We're going to need booster shots anyway. So, but I am concerned about the other pandemic, the mental health pandemic. Thanks.
Yeah, thank you, David, for that. That's very key. And I just want to reflect on what you said about starting the phone tree. That's very critical, especially for individuals, whether they're, and this is not an ageist thing. Some individuals just are not very good with the social medias and the technology. And so in actual picking up the phone, word of mouth, and actually getting hold of somebody is actually very appropriate, especially during this pandemic. And we're not able to physically see and touch people like a lot of us would want to do. And so thank you for you all doing that. And know that is very appreciated by your congregants and even in the distribution of the food, everything. So I thought I just saw something else come in. Is there any other responses regarding our first question that we have here? Some of the things that is kind of you all have done to support your community, your spiritual community during the pandemic. Anybody else? Okay. All right. So we're going to go to our next question. This right here, as I indicated, being on the front line, both for my, employment with the county, as well as, being a faith leader myself, How have you taken care of your own emotional and mental health during this pandemic? David, you mentioned the rise of, the mental health pandemic. That is something that has been extremely heightened due to the isolation that we all have experienced. And so if you look also on the screen, there are some, this is from the Spirituality Initiative. We came up with this few years ago, I want to say back. And as you can see, it's just experiences, hope, finding meaning of life, acceptance love. This is something, it's a tool that you can have access to, that you can share with any of your spiritual communities and stuff that will help them understanding, especially now more than ever, the dynamic that we're all in right now. Do you all have any examples of how you've taken care of yourself and maybe even improved your wellness? Maybe you picked up a new hobby. I went back to school. I'm now in my PhD program. I don't know if that's more me taking care of myself, but it's a whole lot of work now. Who's going to get us started? Okay, that's good. Yep, getting back into having therapy. That's very helpful. Let's see. Bill, do you have another example? Something that you've done to?
Sure. Well, in my life, all my life, music has been a really critical part of it. And so, when you all came on, you may have heard the African American Spiritual Choir singing. And in our church, we use African American spirituals a lot. We sing them. And though we can't do it as a congregation, that is a part that, that I listen and I grow, and I feel like it does indeed help me personally. Obviously I take a certain time each day for personal devotion. For me, it's prayer, meditation, reflection, sitting in quiet. I think sitting in quiet sometimes is really, really critical. So you can, hear maybe things in a different way. So those are just two of the things that I do. Nature is real important to me. I fortunately have a yard that actually has some redwoods growing in it. So I can just look to them for nourishment, for spiritual nourishment. So, I find it there. There are several, those are three ways anyway, that I find that it helps to keep me, because we're not, our church is not meeting as a church in together. I have a small congregation, and I'm fortunate in that sense. So most of it is by phone, and so that's what it is that I do. Those are the three of the things. I know there's other things out there that people are doing.
Yeah, I saw that. I think it was Susan that indicated, physical exercise, so getting out. I know, especially during the early part of the lockdown in the beginning of last year, I was on leave, and so one of the things that they had us, they encourage everybody to do was actually, like you mentioned, get outside, get in nature, especially in a wide open area. You see the picture of my background with the trees. I like, getting out and doing a hike or a walk or a jog. More so walking now, not really jogging, but those are definitely examples that we all can do to better take care of ourselves. That and getting into ministry a long time ago, I learned that if I don't take care of myself, how can I support and take care of the people that I am providing support to spiritually? My vessel, my body, has to be in condition to be able to do that. So that's just something to keep in mind. Let's see.
I see a hand raised from John.
Yeah, go ahead, John.
Yes. I have a unique opportunity. I've done a lot of volunteer work over the years with Habitat for Humanity, and building housing, and especially affordable housing, has been an essential business since the beginning. So it's been unique in that everything's shut down, but volunteer work continued to be available at a project that they're doing in Daly City. So I volunteered to become a regular volunteer, and every Wednesday I go up and spend all day essentially being a carpenter, and it's physical exercise. It's working with like-minded people. It's, blessing people that desperately need housing. So it's been a great way to just totally divert and do something that just seems normal, but very beneficial.
Yes, that is definitely beneficial. And that's also not only, I'm pretty sure you all would find, especially since you are involved in some type of spiritual support, that when you are able to give to somebody else, it's given to yourself, and that is something that I think we all can attest. That helps us, when we're giving back, it helps us feel better as well. And yeah, I definitely wanted to point out, yes, that Susan Holland is the one who indicated physical exercise. Do you have an example of some of the physical exercises that you're doing, Susan?
Oh, on the site?
Oh, no. I was sorry, John. It was pointed out again that Susan was the one who said physical exercise. I was just wondering if she had an example of some of the physical exercises that she's doing. Most people think of walking and running, but there's, John, that's a physical exercise, actually, building housing, you got to, and everything else. So that's a different type of physical exercise. So any other example?
Yeah, Isaac. So my husband and I like to do bird watching. So it's a lot of walking around outside, in nature, like you were saying. And also I have an exercise bike. So I just have made it now a habit that every morning I get on there and I ride for half an hour just to, knock it out.
Awesome. Okay. Let me see. There's an. All right. That is awesome. The exercise bike. Yeah, that's something that I should probably do a lot more, especially since my wife has one and I do not use it at all. I thought there was something in the chat. Let me see. Whoa, I think I went far up. Okay, I'll get it. Oh, okay, yes. We something that Anita pointed out was that she did a Mlk Walk in the community near Dunbarton Bridge, and we just had Mlk Day. And I know for many years prior to the pandemic, doing the walks and the Freedom Train ride was something that a lot of people engaged in. So I wanted to acknowledge that, yeah, one, we had Mlk Day, and two, the walk. I'm pretty sure that had to been very inspirational. One of the things that I used to do regarding Mlk Day was, and it was also exercise. We would, my fraternity, because I'm a same fraternity as Dr. Martin Luther King Jr., Alpha Phi Fraternity Incorporated, we did park beautification, and it was big. We had, hundreds of people out beautifying some of the parks in Oakland. And so if you like nature, gardening, that's another thing that you can take advantage of during this time that we are all more isolating and distant, but still do it outside, socially distant, the appropriate way. And then that's something that Louise talked about, like even once everybody's able to get vaccinated, that we still want to maintain social distancing, wearing masks, as the science and the data is still ever developing right now. Let me see where we're at on time. We are doing great on time. So is there any other feedback that anybody has regarding our second question?
Isaac, I thought it might be good too to maybe highlight a couple things that have been going on in the chat for folks that have been answering some of those questions, if we have time for that as well.
Sure. Yeah, we definitely have time right now before we move on to it. So let me see. Would you like me to do that? Or is there anything particular that jumped out to you?
I think folks just have a lot of questions, I think, about how to get involved and the specific priority groups, as well as the vaccination equity group. I don't know if Shireen, you've noticed any trends so far as you've been entering things in the chat.
Yes, and thank you, Shireen. I saw you pop up a lot of times on responding to a lot of these comments and questions. Was there anything particular that you saw, Shireen?
one maybe keynote to say is that we do have a vaccine equity communication equity working group that Louise mentioned. It is very open to any of you who would like to join. And this week was the third week that we met. There's over 130 or so people that are participating, and we regularly get about 100 people each time. We just recently, as of yesterday, started to move into breakout groups to specifically focus on outreach, communication, key messengers, the types of messaging needed to reach our communities of color. We started a Pacific Islander group, an African American group, a Latinx group, LGBTQ plus group, Filipino, Chinese, more generally 65 plus. And if any of you are interested in joining any of those to bring the voices of your congregations and your expertise and experience, please email me. My email is in the chat, and we can have you join any of those that you're interested in.
Okay, yeah, and I see that there's also, I think it's in the chat, but we can definitely put that in regarding the communication group in the chat. So we'll put that link in there for everybody to do. And this, if you look at a lot of this information is going to be on the Office of Diversity and Equity's website. There should be some of this stuff, definitely all of it on the county's website that Louise pointed out. And then there will be some information also that will be on the Spirituality Initiative's website. And
Isaac?
yes.
This is Maria. I was also thinking, I know that, the mental health concerns and, calling it the second pandemic or pandemic within a pandemic was also mentioned. And, I know you with the Spirituality Initiative have done so much work over the years to provide mental health trainings or collaborations, different, resource fairs, educational fairs, getting different mental health experts to come to different congregations to support our communities of faith and our faith leaders. And so I think that's another resource that, the Office of Diversity and Equity can work to help. I will put my email in the chat as well. So if you have any questions, we really hope to make this a relationship with you all in order to, really work together in helping those who are in so much need right now. I've heard, the number of deaths and losses. We've had more mental health emergencies with our youth and with our older adults, just across age groups. So, you're not alone, and we are here together is our hope to support. So I just wanted to add that.
Yes, thank you, Maria. We definitely wanted to, even though this is our last meeting per se, we definitely want to have the Spirituality Initiative be a guiding bridge, a liaison, so if you would say, between the faith community and San Mateo County. Within the health department. And I know, just as I know Bill and myself, our congregations are in Alameda County, and this is something that, all counties is looking into doing. My church is, although we're not in session right now, we've been deemed a mental health friendly church. And that's something that the Spirituality Initiative, we wanted to help being able to provide that support. As Maria was saying, there are spirituality trainings, there are mental health trainings that we have conducted and I've done. And so that's something that if you're interested in having either yourself as the primary spiritual leader, or even one of your other ministers or a deemed person appropriate by yourself, that we could, collaborate and make sure that we can provide the support and the trainings that is needed for you and your staff. I see there's a hand up. I see Tal. Oh, you're muted.
Yes, thank you very much. So with regard to the mental health, and I totally agree with Maria. So the Pacific Islander, we have a contract with Alameda County and the behavioral mental health. So it's called Pacific Island Wellness Initiative. And we serve Alameda County. However, what we're finding yesterday, we pulled in our staff who are case investigator and also contact tracers and resource navigators that we've hired to work with Alameda County with the HIPAA law, but just to share themselves individually of what they're going through. And I have to say, it's overwhelming. And then having to really speak on behalf of the ability to serve our own community. They have to serve all the community, but when they are given the opportunity to serve our own community, that's like a whole new, that's a whole new dynamic as far as serving their own community. There's a sense of, wanting to do more, but what I'm saying is that the mental health is not only for, the folks, our community, but everybody that touched COVID and really assisting the people. There's a lot of hurt out there mentally, and bless their heart, they're being so patient about it. But when they're dealing with their own community, they do see the inequity in serving the community themselves. So they are poster childs for bringing these to the forefront. However, we also have to be very careful with the HIPAA laws and whatnot. But who's doing what for them is the next question. And we're finding that out because we provide this service for free to our community, and we are reaching out to our own community that are doing this work and say, where is the need at? Let's get, let's speak with you and doing one-on-one, but they are actually having the opportunity to create their own culturally humility way of working in the mental health in COVID, in this era of COVID. There's a huge difference in that. And we're so happy because it's also improving our own mental behavioral program as far as how do we reach the COVID community and this climate that we are in, completely different. So I'll just stop there, but I think we should all share best practices. This is Alameda County, but I know, we can also, one of our employee staff is from San Mateo County. And so we're learning a lot from them as well. So anyway, thanks for the opportunity, but I just want to share that little piece there.
Thank you, Tom. And I know I saw that Reverend Mo has hand up.
I just want to follow up on Maria. Reminder, as we met yesterday, Maria, that you'll be part of that youth services that I'm putting together for the mental health part.
All right. Well, the next, so we're going to go ahead and now we're going to go to the third guided question that we had. And this is something that even a question, and I don't think we knew this ahead of time. This is a question that actually Louise kind of asked and also even gave an example of. So are there any recommendations that you all have as faith leaders that can help San Mateo County with the vaccination rollout? Are there any examples, suggestions that you have? Again, we're all learning from each other and are taking every suggestion and consideration. So are there any things that you all think that would help with this whole rollout?
Isaac?
Yes.
Sorry, I don't mean to talk a lot, but in the San Francisco location, because we are also have two mobile testing site, in San Francisco, they're already talking about mobile delivery for vaccine at the testing site. So I'm thinking about for hard to reach community like our Pacific Islanders, is that these testing sites become a trusted location for our community to come and get tested. And so perhaps there might be a conversation around the possibility of utilizing these trusted locales for our community or just for any community to get vaccinated. So I don't know where the conversation is in case I missed it somewhere.
Well, thank you. That's a great example, and you don't have to apologize for keep coming in. That's good. This is what this is all about. We need the dialogue, and so yeah, that's a great example. If there's already a trusted site, and I know there are definitely parameters and guidelines that are out of the county's control, and again, that is what we were talking about earlier. That it's getting things to the state level and ultimately the national level. So Louise, I know you have something to say. Go ahead.
Yeah, we really want to make that happen, Tao. I think, and there are some conversations underway. The two first vaccines, the Pfizer and the Moderna, are definitely harder to work with in those kind of settings, but some of the other vaccines that are coming are going to make that a lot easier. And we also want to encourage partnerships, between organizations that kind of bring both pieces together. So for example, local pharmacies, have a lot of potential, they have some of the stuff that's needed to make this happen, but they don't necessarily have the community outreach or the relationships. We also know that neighborhood clinics, that they have some of the capacity that's needed, but they don't always have all of the relationships that would be needed. So anyway, the testing relationships and those nonprofits that have partnered, this is like a great, it's just low-hanging fruit. And if it weren't for the physical requirements of the vaccine, the freezers, the fact that even carrying the vaccine from point A to point B, it has to be a nurse. That's what makes it a little bit harder than the testing. But we are thinking that this is one of the most important strategies. And I think the Johnson & Johnson vaccine that's coming may be a lot easier.
All right, thank you, Louise. And I want to point out, I saw that Sue had mentioned something regarding volunteers needed and that their communities wanted to help. And Louise, talked about that and how the challenges with that, this is different than the actual testing. And I want to also point out that thanks, Shireen, for answering that question and also providing a link to the portal for the county volunteer portal. So that is good. Thank you for responding to that question right there. Are there any, and you mentioned, heard a lot mentioned earlier and also recently about, collaborative efforts in terms of phone, calling people over the phone. So if you go to our link for the volunteer effort, that's something that, there might be another avenue that it's not actually physically going somewhere. It's actually, picking up the phone, calling people, especially for people that are technology challenged, emails for those that are not, and might as well do the old-fashioned postage to the mail. Are there any other examples or suggestions that you have to help with the rollout? Something that maybe just popped into your head, something that somebody said?
It looks like we have a hand, Michelle Torres.
Okay, sure.
Hi, I'm with St. Paul's Episcopal Church, and we are just interested in knowing or wondering if it would be possible to help become a vaccination site. And I was wondering if we had any information on that.
All right, Louise, go ahead. I think I see your hand. Yeah.
Yeah, I think if you have that kind of interest and you have, physical space and all of that, which right now is usually outdoors, you should just reach out to us, and you could just reach out to me. Right now, what we need is the clinical partners, to be able to work with a local site like that. And we have been trying to find those clinical partners, including getting other organizations like, that are in the business of medical care to be the partners. And then when we have those partners, we will need, local organizations that aren't already involved. We have a bunch that are involved. As Tao mentioned, we have like nonprofits that are working on testing and all of that, and there are logical places to turn. But for those of you that haven't been involved, that have an interest, I think it would be just a reach out, so that when we have like the other partner to put into the picture, we can start to pair people. We're hoping that the vaccine supplies will start to flow so much more that we won't have a barrier of supply and that all the partners that want to play a role could play a role. Right now, that isn't the case, but we can plan for a future where that is the case. And we know that especially local organizations that are, where people don't have to travel, that's really going to be a great pathway for some of our residents.
Thanks, Michelle, for answering asking that question, and Louise for responding. I see Reverend Mo, do you have your hand up still, or is that from before? Okay, I wanted to make sure I didn't miss you, especially since I saw you on my screen. All right. Anybody else with any other? And I also think is also to acknowledge what Louise pointed out again is that the supply, and so I think you all being on this call can definitely go back and provide, because she talked about covering her presentation about the misinformation. Right now, the supply is low, and once that supply picks up, this is why this is so important, is having this collaboration to be able to, once that ramps up, to be able to get it out as fast as possible. Were there any? Go ahead, Reverend Mo.
And what's the update on the supply? We hear a lot of different noises, and there's no stockpile by the federal or anything like that. What's the update, Louise?
There are a couple of things. One is that the federal government has been, really debating and wrestling with this idea of should people be using second doses? So when we roll out the program locally, we're saving a second dose for every person that gets a first dose. We feel at this point that's really important. It feels like a tremendous act of bad faith to vaccinate someone and tell them they can come back in 3 weeks or a month and then not to have that dose. So right now we're holding second doses, and so are our partners that are getting the vaccine directly. But that's something that the state and the federal government are really debating, because they know that if there's half the inventory is being held for second doses, that's a lot of inventory. And, they're debating whether they should just let all of that go so that, more people can get their first dose. So that's one of the big issues. The second is that the manufacturers are operating at full tilt, Pfizer and Moderna. And we believe that the federal government has purchased an enormous quantity of the vaccine, and that's good. But there are some issues around potential shortages of other supplies, like their special needles. And so the federal government is working on that. So those are just a couple of the issues. The only other big one is that there's other vaccines that are in the pipeline. And if they could be approved, like the Johnson & Johnson, that would massively help. And it would massively increase the supplies. I have no reason to believe that there's anyone sitting on stockpiles except second doses, which I totally understand the need for that. And that's the only thing about stockpiles that I'm aware of. And I don't really think of that as a stockpile, but rather a necessary second dose for a person who needs it.
Thank you. I also wanted to remind everyone that I think it's in the chat a while ago, but the survey, that was something that you all were able to complete. It should have been also included in the email that you received as well. So just wanted to keep that in mind. We'd love to get your feedback on everything that transpired. So if there is there not anything else? Wait, I'm seeing something pop up. Just make sure. Okay, I'm not sure if there's anything else, but I just wanted to thank everyone for participating in our dialogue today. This was definitely enriching for myself, and hopefully you all were able to come away with some good nuggets, information to be able to pass along to anybody in your spiritual community. There's a couple things I just want to point out. So I want to thank everybody for joining us. Please complete the survey. I see the prompt right there. Additional comments and feedback, you can go to the Office of Diversity and Equity. It's right there, the link right there. It's also a link that you got in your email. It's also in the chat. We'll be sending out the recording and the PowerPoint of this meeting for everyone that attended. And I know there was a question earlier, and I think it's something we actually covered in our pre-meeting, is if there are translations or something like that, that for some of the materials that you saw or that we'll be sending, just please let us know and we'll be able to try to get those translated in a timely manner that's appropriate. Given that the guidelines that a lot of us are working under, it may take a little longer than usual. So we want to make sure we'll be able to provide that to you. Please also go to the Spirituality Initiatives site. You can go to that right there. We meet every second Tuesday of the month from 12 to 2 p.m. Myself and my co-chair, Melinda, who's not able to join us because she's doing what one of you guys were talking about, I think was about being the caregiver. And so she's somebody that is doing that. So we want to appreciate her as well. I want to acknowledge my co-chair. And so with that, I want to just send some special thank you, obviously, to Megan Gosh, to Louise Rogers, also to the Office of Diversity and Equity, BHRS, Peninsula Solidarity Cohort, Office of Community Affairs, Spirituality Initiative, and San Mateo County Health, and all very much so all you all for joining us on this call, this dialogue. As I indicated earlier, we're and I think it's so fitting that part of our actual heading that was changed, at least you can correct me if I'm wrong, I want to say 2.5 years ago, San Mateo County Health's logo, maybe it might have been a little bit less, is all together better. We are really all together better, especially as faith community and leaders. Whatever the domination or fall or particular spiritual practice that you do, we're all really better together, and having a collaborative effort is something that we want to do. So the Spirituality Initiative has an open door policy for you all to come participate. And I know you all are very busy. And so if you have a representative, you can do that as well and send them to have them attend our meetings. And so